Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. We're live in studio. It's gorgeous outside. It's a beautiful day. You should be out walking after you get done listening to us. Nevertheless, we're here to answer your questions at 888-630-9625. That's 888-630-9625. Love to talk to you on any subject that you have in mind. Perhaps you've had a problem, you've tried, you've applied, you've done everything you can think of, and guess what? There may be an answer without drugs, without surgery. That's why we're here. That's why we do this program, to kind of give you a different look, a different perspective, that you have the capacity to heal yourself. Your body has everything that it needs. It just doesn't need the interference and, you know, the things that you've messed up over a period of how many years? Well, that's the rest of the story, as they say. 888-630-9625. Have a different program for you today, one that I got kind of coerced into and kind of beat about the head and so forth, and particularly with one practitioner, with many of you are intimately familiar with, and I was told that I had to be the interviewee today, and to do that, it's kind of going to be an interesting program. I'm not sure what I'm going to talk about, but Dr. Stephanie Pina, many of you love and enjoy her presentations. I'm the guy that's on the firing squad today.
You can tell them I bullied you into this. That's okay.
You did.
Yeah.
You did. And how long has it been I've been putting you off on an ongoing basis?
Good year.
Yeah, pretty much. Pretty much. See, they said, okay, you interview all of us, and now we want to interview you. And, you know, so every doctor meeting goes one to the other, and I say, well, we'll do it some other time. So this week at the doctor's meeting, Dr. Pina said, I think it's time. I think we're going to get this done. So having said that, Dr. Pina,
I get to take over now?
Just remember, I have a 3-second delay.
Okay.
Okay.
Well, yeah, I think one of the main things, too, is when we come on as the doctors on the radio show, we do talk about a number of different topics. Everybody who's listening to the show is very familiar with the fact of how knowledgeable you are and everyone else is. But I don't think they really get the gist of you.
I fake it well.
Yeah. So I think it's due to basically kind of go in there and ask you some questions about, you know, the basis and how you kind of see health has ranged and changed over a period of time that you've been in practice. And, you know, that kind of incorporates a lot of the frequent questions we get either in the lectures or on the radio. It kind of gives that base someplace to go. You
mean like my children say, when dinosaurs ruled the world and, you know, we move forward from that point on?
Absolutely.
I got it.
Yeah,
okay,
we'll start right there. How did it all start?
Well, you know, I've been in practice a long time. I'm in my 37th year of practice, and it was kind of a transition. It was kind of an interesting experience of how I became who I am today, because I'm a chiropractor, I'm an acupuncturist, I'm a nutritionist, and all those things feed into the paradigm that we do in our office, looking at the Triad of health, structural, chemical, emotional, as kind of the initiating things of all that stuff. So what happened years ago when I had made my decision after undergraduate school, when I went to Kent State University in Ohio, to take the next step, I was supposed to go to medical school. And I was accepted. I was going overseas. I was accepted at University of Milan. I had an uncle who lived in Milan. And my wife-to-be at the time, Sue, and I were going to live in Milan, and I was going to go to school, and we were going to do that thing. Well, as a curious young lad that I was, had 10 months before I could start, I heard about this craziness called chiropractic, and I decided that I wanted to check it out. So I went to the National College of Chiropractic in Chicago, which is now the National University of Health Sciences, and started in. So I was going to spend 2 semesters and then leave. just enough to find out so I could kind of integrate my concepts of things that I believed in. Well, Sue came out to Chicago probably about 5 months before we left, and she had been suffering with migraine headaches from the time she was 6 years old, to the point where 2 days out of every week would be destroyed either by the migraines or the medications that she was taking. And subsequently, they told her that when these headaches and this head situation got so bad that medicine wouldn't touch it, that they would do a fusion of the neck. They would lock all the vertebrae together in an attempt to stop the nerves from being irritated and the spinal cord to be irritated. And, by the way, she had very severe endometrial tissues around the uterus and the ovaries, and they said, you're never going to have children. Her menstrual cycles were horrible. The pain she was in that time of the month was devastating to her. And so they said, while we have you on the table to do the cervical fusion, we'll also do a total hysterectomy because you're not going to have children anyway. Obviously, that wasn't okay. Mm-hmm. So we decided, listen, as long as we're here, let's see if this stuff works. I'd never been to a chiropractor. I'd never done anything with acupuncture. Never done any of those things. So we started in a clinic in Elgin, Illinois, under the hands of a guy by the name of Dr. John Kellenberger. It was a Kellenberger clinic, and they do structural work. They don't do the things that we do in our practice today. And the short end of a very long story is that within 2 weeks, her headaches stopped. They were gone. And she stayed under care for about 18 months to get correction of the structural system, neurology, and so forth. And today I have 2 children and 5 grandchildren. So I said, I don't have to go anyplace else. This is it. And then the evolution of what I do in applied kinesiology, looking at structural, chemical, emotional paradigm and how the body is integrated with all those things from the nervous system to acupuncture to nutritional pieces and lymphatic waste removal and the movement of spinal fluid. That's what I've spent my life dedicated to helping people with.
And that's how we ended up here.
That's how we ended up here. Actually, that's a long story, too. But
we're all working on the happily ever after part as we speak.
That's called a legacy.
Oh, okay.
Yeah, that's the thing that we want to put together so we make sure that we have the ability to help as many people as we can on an ongoing basis, to train doctors to do what you and I do, and to get people to understand that the title of my book, Health is a Do-It-Yourself Program, that you have absolute total control virtually over anything that happens to you, barring, a car accident or something of that nature, but you have a profound effect on how your body systems work.
Now, we hear over and over again, like you're saying, chemical, biochemical, structural, mental, emotional, all the time. And I think what comes into play a lot of times is people come in with one part of that triad all the time, but the other parts kind of have to fall into place. I mean, there's never one, it always has to be balanced, like you always say, like there can't be a missing piece of that triangle or one side longer than the other in order for that complete health to be there. Why do you think it is that with the current health system or the way we've been taught, not political,
yes,
the way that we've been taught as far to think of our own health, why is it that we always go in with that one part of the triangle so much more prevalent than the other sides?
Weak link is what takes the hit. We look at the way we live our lives. We look at the environment that we grew up in. And that environment sometimes can be over-inundated with emotional stress. Things happen in our families. We make decisions about things. Reality really is a decision-making process. So something happens. You and I have the same experience. Based on my background experience, I decide it means whatever I think it is. You decide it means something totally different. And it has subsequently a profound effect neurophysiologically on how the body operates. We grew up, for example, as I've said many times, I'm first-generation Sicilian. And when my family came over here, they tried to eat like they ate in the old country, Mediterranean diet, which we know is great for you, right? Mm-hmm. Well, with the exception that the flour that they used over there was not the same kind of flour. It was so heavy, so golden in color that if you dropped it on the table, it would rattle the table, if not break it. They didn't eat a lot of meats. They ate a little lamb, some chicken, some fish, tons of vegetables, and they exercised daily. They walked. They breathed fresh air. Their mental state, their families were the center post of everything. So they tried to duplicate that. They came over here, but the food wasn't the same. Instead of honey, we had white processed sugars. We had white processed flours. We had fried foods. We had all the fats and the things that were added into all these things. Had I continued to eat the way I was raised and continued in the early part of my college years in undergraduate school, I would be in major trouble. I would be like every other American. I take no medications. My blood pressure runs about 116 to 118 over 68 to 72 on a regular basis. I can do pretty much what I want to do all the time. So, but how many Americans can do that? It's a process of indoctrination, if you will. The Fifth Avenue marketing does such a beautiful job of making us think that we have to be a certain way. McDonald's, Burger King, not to single out one of them. We eat their foods, and there's no standardization of quality or care. We have fecal material in these things that they say, oh, you can handle this much stuff. We're so bad in this country that Europe and Canada and the Virgin Islands and so forth will not accept our food for import. That tells you something about what we're doing here.
So really, even though we're always thinking of the health as far as the physical part of ourselves, it's everything that's really surrounding us, the foods, our environment, everything that's going on. So that all has to be part of the healing process as well.
It is a total part of the healing process. If somebody comes in, and going back to your original question, why do people come in with one side of the triangle? They come in, oh, my shoulder hurts. They come in with, I don't feel good, I'm tired. They come in with sometimes named conditions, a cancer, a tuberculosis, a diabetes, or whatever that is. But you have to answer the question why these things happen to begin with. Where did they start? What was the origin of it? What was the cause? What was the initiator? Because if you don't treat the cause, you treat nothing but symptoms. You're putting the irritation out why the underlying problem continues to break down and deteriorate. So you have to find out, what's their dietary patterns have been like? What's their body's capacity to do based on their lack of exercise, if you will? How do they run things? They look at the glass as being half full or half empty. So the guy comes in with a shoulder problem, and in your medicine, in traditional Chinese medicine and naturopathic medicine, that everything is interrelated. So a guy has a shoulder problem, and the deltoid muscle, for example, that raises the arm to a 90-degree angle in front of you, is weak. So the shoulder's inflamed, it's swollen, it's hot. So they go to the traditional doc, the allopath, and he gives them what? An anti-inflammatory, a pain reliever, something like that, or injects it with cortisone. You come in and you ask the question, how did it happen? Well, we know there's a nerve that goes to that shoulder. Was there an accident? Was there a nerve that got pinched? We know there's an acupuncture circuit that goes to that shoulder that has to do with the lung. We know there's an emotion that's associated with that acupuncture circuit. And could it be that? Could it be that the person's been exposed to cigarette smoke or other kinds of fumes and so forth over a period of time? So when you understand what took place, now you got a better chance of fixing something from the why is that, if you will, instead of treating the symptom.
And I think we're seeing more and more people coming in or even asking the question going, why am I not getting better? I want to do something different about it anyway. So when they do come in, they're willing to go, you know what, I do need to take more importance in every step of the process and be more involved with it instead of just, this is what I've been told to do, this is what didn't work for me, how do I get better? How do I fix the cause and identify the cause than just treat the symptoms?
Well, that's why we've been in practice all these years. That's why I do what I do. It's constant education of our patient base. As you know, patient comes into us and we evaluate them. We try to find out the underlying substantive triggering mechanism of all of this. But more importantly, we want them to understand what they can do not only to repair the process, but to continue to enhance their well-being. We talked about this morning, you and I and Holly met to go over some things this morning in the office, and we were talking about our office purpose. And our purpose is very specific. It's to serve, educate, and empower people to achieving ultimate extraordinary health care by their own hands, by their ability to help themselves and understand the paradigm, to be able to get those tools that are necessary to not make themselves whole and better, but also their family and everybody they associate with.
Yeah, absolutely. I concur.
You concur. Thank you. I appreciate that. See what happens. You said you started getting me to interview and you start talking, but we got to talk about some other things today. Meanwhile, we also want to entertain our listeners at 888-630-9625. That's 888-630-9625. Love to talk to you on any subject that you have in mind, even the stuff that I'm rambling about. So let's see how it fits into your substance and how your problems are not going away because you're not paying attention to the things that we're talking about. And you can very easily allow these things to kind of be history. We'll be right back after some very important messages. Don't go away.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio, 888-630-9625. That's 888-630-9625. Love to talk to you on any subject that you have in mind. We have a little different format today because I was browbeated into succumbing to questions.
I kicked him in the ankle and said, "You're going to do it."
That's right, you did. It hurt a lot. No, Dr. Stephanie Pina is in studio with me. As you know, she's doctor of naturopathic medicine and an acupuncturist, and we work in tandem together a lot on many different situations. But what she's doing, after much coercion and putting her off for a long time, is interviewing me. So, but this is your show, and we're opening up the lines to any questions that you may have, for either one of us, by the way. But before we get back into that, next Saturday, this coming Saturday, which is the 28th, we have a very special event in the office, and it's a limited event. There's only going to be so many people that are going to be admitted. Dr. Poe and my daughter, Erin Roselle Poe, are going to be doing a special event, and that's going to be teaching people how to exercise.
Getting fit the right way.
Getting fit the right way.
How to have exercise work for you.
Wow.
Very official.
Maybe I should go.
I guess I'm going to run it on Saturday the 28th from 2 to 4 p.m. right at the office.
Yep.
And you can sign up the normal way you sign up for the in-house lectures by calling the office at 703-698-7117 and reserving your limited spot because we know it's going to be packed.
Yeah, I think it's $25 a head, something like that.
Yes.
And so they're going to get into it. It's going to be a very detailed, intimate, and again, it's limited. They're not going to have a lot of people there because they want to be able to work with you one-on-one. And so they'll show you how, they'll help you set up an exercise program for yourself. So if you'd like to take advantage of that, I would encourage you to pick up the phone and call our office, 703-698-7117. Erin is formidable when it comes to exercise.
I know she has recently started doing stuff in the office. I happen to have the treatment room right next to her while she's doing that, so I can hear the determination through the walls of everyone. But they keep coming back, so they're seeing their results every single time.
You know, the interesting thing with her is that she grew up with our work. She grew up with an applied kinesiological perspective, so she knows neuromuscular mechanics probably better than most people ever will. And so she's applied that to her training, and she does some unbelievable core training with people. I've seen people come out of there where even after our care, you know, they're better, their bodies' energetics are hyped up, but they still don't have the power that they need to have. And all of a sudden I see them walking down the hall, and I say, oh, my God, that's good.
Absolutely.
Yeah.
I know I've heard Erin speak and demonstrate stuff, too, when she opens up all the Ageless Health seminar weekends we usually do. She gets everybody up and active before they listen to all the good things that we want to talk to them about, and then Dr. Poe comes on in and applies a lot of the terminology and gets us more focused in what's going on there.
You know, we took a lot of hits for moving the Ageless Health this year. It was supposed to be this month or coming up in October, and we used the opportunity actually to change it because we've been trying to do it in the spring forever, because what a better way to kick off the year than, you know, to attend an Ageless Health seminar. So we're doing that. It will be either the last weekend of March or the first weekend of April, and we'll let everybody know that. So we didn't forget it. We just changed it. We just postponed it. It's going to be different this year, that's all.
Absolutely. So in the meantime, you get to come to this and start getting the exercise that gets you through the winter.
That's right.
So you'll be all excited for the early morning.
What happened
exercise.
to summer?
I don't know.
I don't know either. It's gone. I mean, it's like it's finished already.
It'll be interesting because we'll see where we had so much rain during the winter, during the summer, and we had the molds kind of come in so quickly. It's going to be interesting to see what comes in healthcare-wise.
We have a lot of people coming in sick right now, and it hit earlier this year, too. It's been over probably about 6 weeks since I've seen the fall ragweed, if you will, come into the office with people really plugged up, not feeling good, sore throats, glands swollen, just feeling miserable.
Yep. We had a lecture not too long ago when I talked about change of seasons and health and how that affects it, and we're seeing that now firsthand because we went so quickly from summer into a fall and dropped, 30 degrees in a couple of weeks. So
it breaks up the rhythm. I mean, the body has multiple circadian type of rhythms from our friend, the cortisol, up and down, and there's certain periods of the day. But there are certain periods of the year, seasonal, as you've talked about intimately, that people are more susceptible, more prone to all kinds of disease processes. And it has to do with the beginning, the movement of life throughout the year, things growing, sustaining themselves, and then ultimately coming to a natural conclusion. But it should be done gently. It should be done with grace. And unfortunately, it's not, because of that structural, chemical, emotional paradigm we're going to talk a little bit more about when we come back after the news and some important information. But it's, we don't think about what it is that we can do to control our lives. We don't realize that we have control, and that's the most important situation. You do have control, and don't let anybody take it from you. Fifth Avenue Marketing, your traditional physician, or anybody else say, have to take these pills for the rest of your life. That's not okay. It's not true. We'll be right back. This is Dr. Tom Roselle. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live. Yes, we are in studio. 888-630-9625. That's 888-630-9625. Love to talk to you on any subject that you have in mind. We've had a subject today. It's called The Roasting of Dr. Tom Roselle by Dr. Stephanie Pina.
We can get everyone else in here. I'm sure they'll help next time.
Don't get too ambitious. It's fun. All we'd have to do is bring in the rest of the...
All we need is Dr. Poe.
No. That's called the Chicken Chong show, yes. Anyway, we're going to talk about a few other things. We're going to talk about China. We're going to talk about... That trip was a long time ago now. I keep saying, my China trip, that just... Never mind. Let's go to the phones first. Maggie, how can we help you? Thank you for calling.
Yes, hi. I was wondering if your office could help people with depression if they've had medication that didn't help.
The chances are that the medication didn't help. We absolutely can help. But even if the medication did work, the problem is that depression comes in all kinds of different formats, and you have to look at, and particularly in this situation, where, why, and how come. From a biochemical point of view, when you consider that 85%, let's even take it down to 80% of all of your neurohormones, all the brain chemistries are produced in the intestinal tract. And so if they're not being produced at adequate levels, or they're imbalanced, or the gut is irritated, or allergy levels are high, then depression is going to ensue. There was a book that was written many years ago. It's called Sugar Blues. And it was, I think, late 1960s, early 1970s. And it talked about what happens when blood sugars become unbalanced and the emotional highs and lows, the roller coaster that occurs because of blood sugar indiscretions. So the short answer is biochemically, yes. Also neurologically, when there's any trauma or injury to the nervous system, it can cause an emotional upset. And Dr. Pina, from your medicine as well.
Yeah, especially even from the, energetic side. Unfortunately, we're told that these medications can always treat the depression. Well, a lot of people end up coming in and they feel either worse or better, and it's not changing them. From the energetic standpoint, if you don't change how they're viewing the world or identify that cause again, it's just going to keep being there. You can't just block out stressors. You can't block out how you're going to respond. So even if there's things that are outside of the control of the medication-wise, it wouldn't get any better.
The interesting thing, Meg, is if somebody's sitting there, I'm depressed, and then they go to eating that triple hot fudge sundae, and they're doing all kinds of, I'm obviously making all this up, they're actually adding fuel to that depressive fire, and their body chemistry shifts, and it starts ping-ponging around, and then pretty soon you get the diagnosis of bipolar, because you take one thing to go up and another thing to come down, and it's a roller coaster ride that just perpetuates itself until the person crashes completely. So the short answer is yes, absolutely, we can do a lot for someone who has depression or anxiety types of conditions. I hope that helps.
Okay, thank you.
You're welcome. 888-630-9625, that's how you reach us here. And if you'd like to talk to us, not on the radio, but just over the internet, all you got to do is go to rosellecare.com. That's ROSELLECARE.com. Send us a note. We do respond, and it only takes us sometimes immediately, sometimes a day or two, but we'll get back to you. If you'd like to talk to us, call 703-698-7117 and leave a note, and one of my doctors, particularly Dr. Pina, will get back to you and answer your questions. Okay, I'm ready.
You ready for next up?
I think so.
Okay.
Yeah.
So China.
Oh, so China?
We'll just put it out there, because I've even had patients ask me for you to talk about China. Because I guess they assume since I do acupuncture, I must have gone on the trip with you, which I guess you forgot to bring me along, but that's okay.
I did. I'm sorry. I kind of put it out there, but you never responded, so I had to leave without you. That's right. You missed it. It was totally gone. No, it was an amazing trip. It was one that I wanted to take years ago. Matter of fact, there's a story behind all this. Connie, who's been with me for almost 27 years now, the years when she first started with me, I kept telling her, I said, one of my dreams is to go to China and study, because the magnitude of what's there from a natural sense is so profound. And she ended up going and training and doing an internship in China before I got there. But nevertheless, I had to settle for 17 days last year, 2012. And it was an incredible experience. I went with a group of doctors, and we went to Beijing. And the first stop in Beijing was at the Beijing clinic, which was run by a guy by the name of Master Wan Suzhan. An interesting man. He comes from a family of energetic healers, but this guy actually was a medical physician, still is, but he was the medical physician to the heads of state of China, the presidents and the heads of the military. He ran the military medical service. So we're at this outpost clinic that is now a healing clinic from natural substance. No medicines, only acupuncture, manual manipulative work, herbs, and energy healing. And I saw things at that clinic, and we were trained in many different forms of healing while we were there. Obviously 17 days, it's an intense situation. But we were there at the clinic, and we saw things that there's no explanation for in Western society. For example, a guy comes in, and younger man, probably late 30s, early 40s, and he was paralyzed from the waist down, and hadn't felt his legs, feet, anything from the waist down for 5 years. Had a car accident. And they bring him in, they lay him on a table, first time in, and they were speaking in Mandarin to him. We had a translator. There was probably 13, 14 of us doctors surround, the room looking at this gentleman. And all of a sudden, Master Wan and two, they call them disciples or students, that had been studying the energetic arts of Qigong and Bagua and Tai Chi and so forth for years and years and years. And they start moving their hands like they're pushing through water towards the patient. Master Wan is at one end and the students are on either side. And this goes on for about 5, 6, 7 minutes. Then, 7 minutes out or so, all of a sudden I'm watching this, and by the way, we have this on video. this guy's legs come up 90 degrees. And every time they pushed their hands, like pushing through water to one side of the table, his legs went the other way. And then they pushed and the legs went the other way. And I'm looking at this and I'm saying, wait a minute, this guy's legs are paralyzed. He can't move his legs. Then about 15 minutes or so into it, all of a sudden, not only is he moving his legs, but he's levitated 2 to 3 inches off the table. At that point, I'm saying, I haven't been drinking. I'm not doing any drugs. What's this all about? 20 minutes into this process, they're done. In Mandarin, and through translation, he tells Master Juan, and the man is crying. And he says, my feet are so painful, I can't stand the pain. He hasn't felt his feet in 5 years. He didn't even know they existed. And now he can feel pain. It totally shifted my whole headspace of what's possible. Intellectually, you know this stuff is real, and you've heard about it, for decades, and it's been there for thousands of years. But until you see it, and you realize what the body is capable of, and the ability for it to turn itself around like that with nothing that they're doing, but moving the energy that God's provided around us to the patient, through the patient, and the body does what it needs to do with it. You're saying, wow, how's that possible? Another guy came in, and he had very severe spinal stenosis. He was on a walker, could barely walk, and we saw the x-rays, and the x-rays showed the vertebrae, the canals, the holes between the two vertebrae where the nerve comes out, totally closed in most areas, and just the guy was in pain, muscles were atrophied, could barely function. And they did the same thing with this guy, but we didn't see him. We just saw the videos. This was a research institute as well. And they treated this guy for 6-7 weeks, something like that. And then we got to see the films, and we got to see the after, right? But we saw the video of this guy. He's outside in the courtyard, not only without a walker, but running and exercise and jumping around. And we see the films. The canals are open. How does that happen? You look at this. Obviously, his diet was perfect. They were doing acupuncture. They were doing energetic work. They were doing herbal medicine. They were doing all those things all at one time, constantly with this man. And he shows up this way after that. It's amazing. If any of our listeners would like to check this out, go to the internet and look up Juan Sujian. It's WANSU, third word JIAN, Master Juan Sujian, and he's just this incredible teacher. But again, he's a medical physician. He's a master in the energetic arts. The name of his clinic is the Beijing Red Cross Guangzhou. I think it's Guangzhou Clinic, and I'm named after the city in there. But anyway, this is just amazing. How do you come to grips with this stuff? I mean, from a Western head, even with my experience over the years, it takes you back and you say, really? It's mind-boggling.
It's interesting because that's where I was going to lead the next question to. Is how do you bring everything that you learn there and those experiences back here into the clinic and integrate them with what you know is already working, what you have seen there, and go, okay, I can try to apply this. And how do you think patients respond to that now? What's driving them to look for those types of healing?
Obviously, my belief system, and I tell the patients this all the time, they said, do you read the Bible? I said, yeah. And I asked them, do you read the Bible, particularly when it comes to this or any of the good books that are out there? And there's a common thread. Regardless of who people believe that this Nazarene by the name of Jesus Christ was, he said something very profound. He said, these things and greater shall you do. Okay? So what does that mean? That means that all the healing he was doing, all the restoring of life and limb and getting rid of sickness, he basically said, this ain't me. This is stuff you can do. And what does that really mean? That means that the energy around us, the stuff that's in the herbs, the way that we lead our lives can restore virtually everything. And what do we do in this society? We look for a drug. We look for a quick fix. We're told that, you have to live with it for the rest of your life. Take these drugs the rest of your life. Since I started school, there was something wrong with that statement. I just didn't believe it. I didn't buy it. I couldn't come to grips with it. And then when you see things like this that turn it around, I go back into the clinic, and that's why we treat integratively. We know that we need to treat emotionally and support people's emotional and spiritual places. We know we need to treat structurally because we live in this planet and we suffer the slings and arrows. We know we have to treat biochemically, all the stuff that we're exposed to, exogenous things from the outside in. And we look at it from the nervous system. We look at how the blood works and the lymphatic drainage systems and the acupuncture energy and all those things. In your medicine, you look at the Triad all the time. From traditional Chinese medicine, truly looks at structural, emotional, and chemical. So when you look at a patient, that's how you have to look at them. So when a patient comes into us, it's not appropriate to fix the symptom. It's appropriate to ask the question why something happens and then structure a treatment plan that is directed specifically to the why is that.
Well, I think that's an interesting answer there because, I think if in a different mindset, someone could have very similar answered that question going, well, I learned this great therapy and I'm going to start applying it to every person that comes in that looks just like this. And that should work for them because I saw it work over in China. And then I learned this new herb and that new herb. But that's not the way you do it. You're looking at the body as a whole. You're looking at what works for them, not I'm bringing back certain information and using one thing versus the other. You need to really see what's going on with the individual.
Our experiences, yours and mine, are different. Somebody else that comes in the office, how they live their lives and what their exposures are different. The way they interpret things is different than somebody else's. And you have to take that, each and every individual situation, specifically direct it and apply it to the healing process. And that's what we do. That's what we've been doing for all these years. We have to take a break, unfortunately. We'll be right back after these important messages. This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
If you're looking for the best in natural health, wellness, and green living products, shop the Roselle Web Store on Amazon.com. You'll find a variety of products and resources that are designed to help achieve an ultimate state of health and wellness. Shop the Roselle Web Store on Amazon.com today. Visit drtomroselle.com and click on Roselle Web Store. That's drtomroselle.com and click on Roselle Web Store.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series Video on Demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We've been in studio doing the same thing we always do, provoking you, making you interested, making you want to go to the internet or the papers or the library to check things out. But we're here every Sunday at 12 noon at 888-630-9625. And if you'd like to find us off the air, go to rosellecare.com. Want to remind you, coming up this Saturday, the 28th, at our office from 2 to 4 o'clock or so, whenever they decide to finish up, which could be any time, Dr. Leonard Poe and Aaron Roselle Poe are going to do a day on exercise and teaching you and training you how to really get a hold of your exercise and do it and apply it properly. We'd love to encourage you. It's a limited class. Not everybody can come because once they hit their level, they're done. They're not going to get involved beyond that. So it's $25 a head. If you'd like to join them, call 703-698-7117, 703-698-7117. Tell my staff that you'd like to attend. and we'll reserve your seat, and you can be there with them. And I promise you, it's going to be an experience. Erin's great. She's a lot of fun. She understands spinal biomechanics and core training probably better than most people do. Having said that, Dr. Pina, the show is yours.
All right. So I thought we'd end it in a fun way.
Uh-oh. I have no clue either. This I'm being set up, but that's okay.
So a couple of questions. I'm a big fan of the Inside the Actor Studio on Bravo, and he always asks, James Linton always asks questions at the end. And we talked about one that I'll ask you in a second, but first, to throw you off completely, favorite word?
Favorite word?
Favorite word.
Passion.
Least favorite word?
I can't.
Favorite color?
Red.
If you had to do a profession other than the one you do, what would it be?
Oh, wow.
Got him.
If other than the one I'm doing now?
Absolutely.
I would be a child's advocate legally.
Okay. And then the one question they always at the end, if you're standing at St. Peter's Gate, and what would be the one thing he would say to you? What would you want to hear?
Congratulations, you made a difference.
And see, I got you again because we just talked about this where you just brought Jesus into the whole mix, and you just said he's telling you can heal yourself, so he's going to come back and turn you around because you just plagiarized him with your to-do-it-yourself book.
Oh.
So you may not get in. That might be the side of the gate you just don't see.
Yeah, well, I have a lot of friends. That's okay. Yeah, that's dirty. Thank you.
You're welcome.
I appreciate that. That's true, though.
But one of the things I think the amazing thing whenever we hear you on the radio, too, is you hear the drive and the passion and trying to get people to really empower themselves to make changes in their life. And I think that's really one of the main things you have to see when you're looking for anyone who has more of an integrative approach, more of a holistic approach, no matter what they're doing. That,
and finding the right people to do what we do is critical, and you have to do your homework. It's really about putting it all together, finding out, are they trying to fix the symptom or are they trying to fix the cause? Are they trying to look at one side of the triangle or are they trying to put it all together in one piece, truly putting together one piece? Are they trying to educate the patient and empower the patient, or are they trying to do what I tell you to do? That's not how it works. And you have to take the next step and to try to help people. That's why we do what we do. That's why we're here. That's why this program. That's why we continue to try to extend ourselves to as many people as we can. This is Dr. Tom Roselle. I'll see you next week. Bye.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give
you.